Okay, the next step in the examination of the abdomen is the palpation. Really, palpation of the abdomen is conducted via two issues. First of all, or via two steps. First of all is the superficial light general palpation, and the second one is the deep palpation. In both you have to check for the masses, tenderness, and in the latter you have to check for visceromegaly. I will start with the examination of the superficial palpation. First of all, you have to ask the patient about any area of pain and make sure that the patient had been relaxed for palpation, and then you have to rub your hands because most of our training time is conducted via the winter season. I'll start from the left iliac fossa. In such a manner you have to have a straight, almost straight arm, and slightly flex the metacarpophalangeal joint in an anti-clockwise direction, and your eyes should be directed to the patient's face to see whether the patient had any tenderness or not. All this about the superficial palpation, and then in the same manner but a little bit deeper, and also ask the patient whether he had any area of pain and prior to that, and to see his facial expression about the pain. Deep palpation or superficial palpation, as I said, it is performed to check whether the patient had masses or pain. After that you have to check for visceromegaly or to check the internal abdominal organ. For the liver, really we have two methods. In the first one, I'll use my radial surface of my index finger as a sensory part after asking the patient to take a deep breath. With each height of breath you have to press. هسه حمادة نفس من حلقك وذبه. شت ايدك بعد 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 شت ايدك بعد. Okay, this is about the first maneuver. The second maneuver I'll use the tips of my finger. هسه حماتين نفس وذبه. شت ايدك بعد 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 عشت ايدك بعد. Okay, once you reach the costal margin you have to detect the liver span. How we can check the liver span? As we say, this is the suprasternal notch below which there is the sternal angle which correspond to second rib. This is the second rib, so this is the second intercostal space. I'll start percussion from here. To see the level at which the percussion notes became dull. Now it becomes dull, and then descend down, and then I'll start from the right iliac fossa upward to until the percussion notes became dull. So this is the area of dullness. We can check the liver span here. So it is 11. Normally the liver span is about 14 plus minus 2. Once you check the liver, or once you detect the lower edge of the liver, or during the examination you had detect palpable liver, you have to check the liver characteristics, which are the size, that's to say the liver span, and whether the liver is pulsatile or not, and then the edge surface consistency, and whether the liver is tender or not. All this about the liver. After that I'll check for the spleen. Just to first maneuver you have to support the tissues here slightly, pulling it, and also ask the patient to take deep breath and start from the right iliac fossa. نفس نفس عشت ايدك بعد 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 عشت ايدك بعد عشت ايدك. Then I'll perform the second maneuver. هسه تندار علي النص عشت ايدك. Also support the tissue here, but start from the left hypochondrial area. نفس نفس وذبه بعد بعد. عشت ايدك. هسه ترجع لمكانك. After you check the spleen you have to check for for the kidneys. Kidneys are bimanually palpable. You have to press the tissues in the at the renal angle here, just like here. Press it upward and slightly lateral to the umbilicus and slightly above to check for the left kidney and then the right kidney. Also, after asking the patient to take a deep breath, نفس بعد عشت ايدك. Also from this side هسه بعد. Okay, we'll see that if the kidneys are enlarged, you will see them that they are descend with each inspiration. After the kidneys, you have to check for para-aortic, for abdominal aorta and para-aortic lymph node. For abdominal aorta or para-aortic lymph node, you have to put your fingers side by side, slightly lateral to the left, to the midline, and press there. First over for the abdominal aorta and then to press deep for para-aortic lymph node. If the para-aortic lymph node are enlarged, they will be palpable. Otherwise, they are non-palpable. That's to say, in the normal status, no para-aortic lymph nodes could be palpable. After that, you have to check for at the inguinal area for common femoral vessel and lymph node. First of all, you have to check for the femoral artery, which is the landmark here at the midpoint in the mid of the inguinal ligament. If we see here, you can see my finger now had transmitted pulsation. Really, here we use a mnemonic, which is nerve, artery, vein, empty space, lymph node. From here you can check slightly medially for vertical lymph node, both lateral group, medial group and lateral group, and then you have to check for the horizontal group. Also, don't forget to compare with the left side. All these issues and skills are really required for the palpation of the abdomen.